I'd like to take a moment to talk to you about anterior scoliosis correction and a new technique that we have been offering our patients. You may have already heard about some of this in our initial discussions in the office, but I wanted to give you more detail and give you an opportunity to listen to this video and then formulate additional questions that you may have. What you may have heard, or for those who have not heard this discussion before, the standard of care for the treatment of severe scoliosis is a spinal fusion. And in the recent past, over the past 10 years or so, that has largely been done from a posterior or back approach. So we place rods and screws as shown here in this model. These aren't particularly expertly placed, but one of our reps placed it. But nevertheless, I think it shows you that these solid rods are placed and screws are placed into the vertebra and the spine is corrected, and that is a spinal fusion. We are now offering a new approach, and this is termed anterior scoliosis correction, in which we're going through the side, we're placing screws and then a flexible cord rod. So the screws look like this, and they go through, and then we use this cord. So instead of a solid metal rod, this cord is placed. This allows us to achieve a correction of the spine, but it also allows motion to be preserved, flexibility to be maintained, and growth to occur still. And it holds the potential promise, although this remains to be seen, of less problems adjacent to a solid fusion in which we can see wear and tear and disc degeneration below. We've been performing anterior scoliosis correction for 2 decades now. You can see here this model shows the placement of screws, and they go through the vertebral body here and they go across to the other side. And in early days of performing this, beginning 20 years ago, we would remove the discs and we'd place bone in their place. And then we'd place this solid metal rod. And we would do that in order to correct the spine and fuse it. What we're doing differently now is instead of the solid rod, instead of the fusion removal, we're actually using this flexible cord. And so this really is a dramatic departure and a change from what we had been doing in the past. There are some unknowns. We don't know how long this cord will last. Will it break in the future? There have been some breakages across the country. There are only a handful of surgeons performing this procedure worldwide, and there are and there will be some of these breakages. But the cord can be replaced, or a spinal fusion can always be performed. So bridges are not burned. So options remain for the patient and their family. There remains to be seen whether or not there'll be less problems below the instrumentation. As you see with a fusion, sometimes there can be disc degeneration, wear and tear below the fusion, with back pain developing later that might require treatment. With the flexible fusion, there's the possibility that there'll be less of that. We also don't know with the flexible fusion or this anterior correction whether or not the discs within that portion of the spine will remain healthy for a lifetime. Will that require a fusion at some point? But again, no options are lost. No bridges are burnt. In terms of the recovery following either a standard fusion or this anterior scoliosis correction, the hospital stay is similar. Both are 3 to 4 days of hospital stay. We restrict BLT, or bending, lifting, twisting, for 3 months for the fusion, but only 6 weeks for the flexible anterior scoliosis correction. So patients get back sooner with that operation. No patients require a brace for either procedure. In terms of the risks, the risk profiles are similar for most of the areas for both procedures. The likelihood of being paralyzed or paralysis is close to 0 for both operations, and most of that is dependent on the experience of the surgeon. But we use spinal cord monitoring and experienced teams as well, which is very crucial. Bleeding from surgery is very minimal with the anterior scoliosis correction, more so with the posterior fusion. And we use a cell saver, a specialized suction, to collect blood, filter it, wash it, and give it back to the patient for both procedures. We rarely give blood back from the anterior procedure, though. Infection risk is almost unheard of for the anterior correction, and it's less than 1% for the fusion. And loosening of the rods or breakage of the rods or screws or loosening of them is very, very low for both procedures. And probably we haven't seen that for the anterior corrections, but quite low. What we don't know is how many of the cords will eventually give way. Will they last 20, 30, 40 years? Will they give way after 2 to 5 years? We don't fully have that answer. So these are questions that remain, but again, it's, I think, a very promising area is this anterior scoliosis correction. I do want to say as a disclaimer that the implants that we use for the scoliosis correction done from an anterior approach, that these are not FDA approved for this indication. But the FDA is fully aware of us performing these operations, which are performed in the best interest of the patient. We look forward to discussing the options with you of either a standard approach or the anterior scoliosis correction with you in the near future. Thank you.